Hi there, this is Anna Dolopo, and today I'm going to present my 110th video, and this is going to be on COVID-19 and its health impact on overweight patients. This is a group presentation that I presented with the soon-to-be Dr. Jamie Kimball, who is a doctorate student with me. She's completing her courses as of this month, I believe, so she will be achieving her doctorate in acupuncture and Chinese medicine, and I want to say congratulations to my colleague. We presented this today, and I think this is very apropos for the entire world to hear. I thought we did a great job on it, and we definitely want this information to be permeated globally. So if you find this video to be very informative, please do share this. And I want to share that I'm going to be doing this presentation, and then I will be giving some accolades to some people at the end, which I don't think I've ever done in any of my videos, but I'll definitely be giving some accolades to my husband, my children, and to my students with the business acumen of successful acupuncturists. So without further ado, I'm going to present to you our power presentation that the soon-to-be Dr. Jamie Kimball and I did today. If you would like the information, we're happy to share the PDF with you. Please just make sure that you that our names are mentioned out of respect, and that's why I'm also sharing Dr. Jamie Kimball's name publicly, because she gave me authorization to do so. We worked very hard on this presentation. So the introduction to the problem is that obesity is a common, serious, and costly chronic disease. Having obesity puts people at risk for many other serious chronic diseases and increases the risk of severe illnesses from COVID-19. I'm going to be reading also from my notes that I shared in my presentation. I'm not going to be reading from Jamie's notes because that's just out of respect for the work that she's done, but I'll definitely be presenting from the presentation and also my own personal notes. So research has found that the more overweight a person is, the more difficult it is to recover from this viral infection. And right now, today, it's November 22. I am in Orange County. Jamie is in Joseph, Oregon. I'm in Orange County, California. And so she lives in a country area, and she lives in a rural area, and I live in an urban area. And we are seeing this issue globally. I think this is a presentation that can be presented anywhere in the world, and you'll understand why. According to the CDC, that's the Center for Disease Control, having obesity increases the risk of severe illness from COVID-19. People who are overweight may also be at increased risk. Having extra weight puts a person at risk for other chronic diseases such as high blood pressure, high cholesterol, diabetes, to name a few. Obesity makes the internal organs work harder. When a person contracts COVID-19, their ability to fight it off is not as easy compared to a person in normal weight. According to the CDC, obesity increases the risk of the severe illness of COVID-19. An obese person is at higher risk of being infected. So I will be reading from the presentation, but I may be repeating myself just to make sure that some of the key notes are absorbed by you, the audience, because I want to make sure that everyone on this planet understands not just the severity of COVID-19, but how our own choices in how we take responsibility for our own personal weight can have a negative impact if we choose to allow ourselves to keep gaining weight in an unhealthy way. The CDC states that having obesity may triple the risk of hospitalization due to COVID-19 infection. So the CDC reports that an obese person has 3 times the risk of being hospitalized if infected with COVID-19. Just from carrying extra weight, an obese person will likely be hospitalized 3 times more than if they were a person of healthier weight. I don't know if you're one of the people in this planet that knows of someone who have died from COVID-19. I unfortunately do, and I'd have to say that those that I have seen get hospitalized or unfortunately have passed with the issue of COVID-19, there definitely was excess weight on their person. A few more facts from the CDC website with their reference. Obesity is linked to an impaired immune system. So our immune system is what keeps us strong. Things like an upper respiratory health issue, ear, nose, throat, being able to breathe, being able to, through our nose, not having clogged ears, not having phlegm, not having allergies. I think we all know what an immune system is, but oftentimes people don't link that when you're carrying excess weight, when we are carrying excess weight, there is an impairment in the immune system. I'm pushing 5'1", and I'm 46. And when I was 20 years old to 22, I lost 48 pounds with the powers of Chinese medicine and other things, but acupuncture and herbs really helped me, and we'll be discussing that in regards to exercise and other lifestyle factors. I know the difficulty of losing 5 sizes. 48 pounds, it's about 10 pounds to a size. 94 to 96, I was 20 years old in 94. I lost those 48 pounds, and when I was 30, I gave birth to my first child. I had gained 60 pounds. It took me about 2.5, 3 years to lose 60 pounds, 6 sizes. And then with my second child, I was 36. I had gained 45 pounds. It took me about 2-something years to lose that weight. And as you see in the white, the baby in white, he's 3 now. He just turned 3 last month. And I'm so excited because I can wear some pants that I was not able to wear, but I gained obviously weight with the baby, and it's taken me time and effort to lose weight with this baby. So I understand that it takes time with female bodies. After pregnancy, it can take 2 to 3 years to lose our weight. So be gentle with yourself, but definitely you want to be in the process of being in healthy weight, no matter how long it takes, 3 months, 3 years, but you're on that process. And it's not just to look good, according to society. It is for a strong immune system. When you're heavier, you have an impairment to your immune system. Obesity worsens outcome. Obesity decreases lung capacity and reserve and can make ventilation more difficult. I'm stating a lot of information from quite a few resources. I'll be sharing, I can share with you the resources if you ask for the PDF, because there are quite a few resources that I have. Let's see. An obese person has decreased lung capacity and reserve. This can make ventilation more difficult. COVID-19 attacks primarily the respiratory system. A chief health issue is an infected person's ability to fully breathe. Couple this with significantly extra weight, then this is a very risky issue, which can lead to a life or death scenario. We want the person to be able to fully breathe. An obese person having decreased lung capacity and reserve is not the ideal situation in a life-threatening situation. If the person must be on a ventilator, the person's chances of survival depend primarily on their ability to breathe with full lung capacity and reserve. So I'm repeating a few things just so it sinks in and you hear it and you fully understand, whoever's watching anywhere around the world, that when you're in healthier weight, that your ability to, that it's less likely that you will, let's just say the heavier you are, the higher your chances of contracting COVID-19 virus, the COVID-19. And when you're heavier, this impairs your immune system. And with an impaired immune system, your lung capacity goes down, which means you cannot fully breathe. So we want to make sure you can fully breathe. That's why a heavier person will have shortness of breath going upstairs. You know, you can do a lot of different therapies, or you can exercise. And there are, you know, if you have some weight issues because of pain, well, then there are many ways to help you heal from pain. Acupuncture is one of them. Chiropractic is one of them. Physical therapy is one of them. Definitely going to see your physician. There are many ways to heal from pain. So I strongly urge those of you who have pain that's impairing your ability to exercise. I hope this scares you to heal your pain in whatever fashion you need to, in the healthiest way possible, so that you can lose weight and have stronger lung capacity. You can breathe better. As BMI, body mass index, increases, the risk of death from COVID-19 increases. That is so important. It's also been found that as a person's BMI, your body mass index, so if you ever go see a personal trainer or if you go to a gym, they're always going to measure your BMI. A person's risk of death from COVID-19 increases. So when we presented this and I read some of the comments later, that was kind of my point. A lot of people were like, whoa, thanks for scaring me, and I'm going to go exercise now. Yeah, I want to scare some of you a little to to a point where you really want to make some permanent changes. Earlier, a month ago or so, my husband goes, wow, you've been really busy in your practice. People want to be healthy. And I said to him, people don't want to be healthy. They don't want to die. And COVID-19 is one way to get people to look at their lives and hopefully make changes so that things like this, your body mass index, can decrease. Not just for COVID-19, but for many other health reasons, which we mentioned earlier: heart disease, digestive issues. You know, I talked about in a Qigong video yesterday how in my fertility cases, you want to be in really good weight standing when you're preparing to conceive. If you are wanting to conceive and you're carrying excess weight, 25 pounds or more, your pressure that you're putting on your certain organ systems, your liver, your kidneys, your uterus, in my opinion, as a practitioner for 21 years, practicing on women who want to get pregnant, that extra pressure from the weight, the extra pressure on your organs from the excess weight, it's not healthy for you. So on top of that, the COVID-19, that's pretty straightforward. As BMI increases, the risk of death from COVID-19 increases. Ugh, that one's a tough one, but you want to not just survive, but you want to thrive. Studies have demonstrated that obesity may be linked to lowered vaccine responses for numerous diseases such as influenza, hepatitis B, and tetanus. That itself has 5 references. So, if the vaccinated against those that have the flu or hepatitis B, research shows that obese people have lower responsive rates, it's as if, to the vaccine, it's as if they should not even receive the vaccines because they won't receive the benefits from them. There's extra fat tissue. You can look this up. It's in quite a few references out there. But I found that to be very important for people to understand that just because we will get a vaccine and you get it, that doesn't ensure that it'll work for you. And it's not just COVID-19, that's for many health issues. If you're getting a vaccination and it's supposed to work for, they mentioned the first one was influenza, for the flu, and you still end up getting the flu. And you can see what the death rate is like with an influenza. Oftentimes these people are heavy, so the vaccination cannot benefit the person. It just won't affect the person physiologically. So you have to understand that. And I hope people really, really understand that you got to put your health first. You can't just depend on a vaccination, because even if you get the vaccination for COVID-19 and you're carrying extra weight, according to this research, they feel that from the evidence from the other medications, the other health issues, the COVID-19 vaccination may not work on obese patients. Someone had asked me that in a private chat on the presentation, and I said, according to the research, yes, that is the fatty layers are part of the reason why the vaccination won't work. The COVID-19 pandemic has occurred at a time when the prevalence of individuals with overweight obesity is increasing in virtually all countries globally. That's from one specific research, Popkin and the other researchers published 2020. So basically, obesity is increasing worldwide and is not does not seem to be decreasing over the years. And with these lockdowns, people are becoming even more sedentary. Not a good mix. So you want to be able to exercise. If you're able to go outside and walk. We'll talk about exercise in a bit. Almost all countries today have a prevalence of individuals with overweight or obesity greater than 20%. So that means that 20% or more of each population of a country are obese. To date, no country has experienced a reduction in the prevalence of individuals with overweight obesity. So, prevention and education. Jamie and I presented how we want to distribute this information. Those of you who know me, I've been in practice since '99. I've learned how to use social media. So I thought, that would be the first place we would start. So I'm doing my part by sharing this video. It is going to be sent via email to all my patients in a newsletter. It's also going to be sent to some of my patients that text me my video, and my friends and my family. We're going to post them on LinkedIn, Twitter, Facebook, Instagram, YouTube, in our paper newsletters, and our handouts in the office and mail. So for those of you who are my students with the successfulacupuncture.com, the business acumen of successful acupuncturists, you pretty much know what I'm going to do. And I encourage all doctors of acupuncture and Chinese medicine, all licensed acupuncturists and registered acupuncturists around the world, OMDs, DOMs, that you all, I hope you find this to be useful, and that you can let your patients know the importance of losing weight, being in healthy weight, and how that affects a person with a person from hopefully preventing COVID-19 from being infected from COVID-19, and understanding that the extra weight puts them at more risk. So many mainstream media articles and research studies are focused on obesity and COVID-19. One such study, Individuals with Obesity and COVID-19, A Global Perspective on the Epidemiology and Biological Relationships, is a systematic review of the physiological mechanisms of COVID-19 and obesity. This study shows a significant increase of morbidity and mortality. So it's already been done by Popkin and his or her fellow researchers, and this year, 2020, already done a systematic review. So that means that there's, for it to already be done this year, means that there's some strong concern of people with excess weight and COVID-19. Facts determined by this study by Popkin et al. Adults with obesity under the age of 60 are more likely to be hospitalized. So if you're under 60 years old and you are obese, you're more likely to be hospitalized. Pooled analysis shows individuals with obesity were more at risk for COVID-19 positive, 46% or higher. So if an individual is obese, you're more at risk. So understand that, please. Pooled analysis shows individuals with obesity were more at risk for hospitalization, 113% higher. So I think this is the part where people started getting a little scared crapless in the presentation, which was a little bit of my goal. Pooled analysis shows individuals with obesity were more at risk for hospitalization, 113% higher. So if you don't want to be hospitalized, go lose weight. I did it 4 times before having kids in the last century. At 20 years old, it took me 2-3 years to lose 48 pounds. And I could have chosen to not. I could have chosen to keep the weight on. I could have chosen to keep the 5 sizes. But I was done. I was done looking unhealthy. I was done having some health limitations. And I don't know what it's going to take for those of you watching who are 25 pounds or heavier. Let me look up what the definition. I remember reading a long time ago when I was, I'm in my doctorate now in the 90s. 98, I graduated my master's. But I remembered reading that obesity is 25 pounds or higher. So let me look up definition of obesity. I'm just going to put on my glasses really fast. The condition of being grossly fat or overweight. What does that mean? So what constitutes obesity? Here we go. Here it is, WebMD. Let's see what they say. So, belly fat, they note the weight, BMI. If your BMI is below 18.5, you're underweight. 18.5 to 24.9, you're normal. 25 to 29.9, you're overweight. So, currently, as of 2020, this is nourished by WebMD. It is November 2020. According to this research, if you're 25 to 29.9 pounds over your average weight, you are considered overweight. If you're 30 pounds or higher, you're considered obese. If you're obese, your doctor might talk about the categories of obesity. Obesity level 1, BMI of 30 to 34.9. Obesity level 2, I didn't know there were obesity levels. BMI of 35 to 39.9. Obesity level 3, BMI of 40 or higher, which some also call morbid obesity. I don't want to go too much into that, but you see how you get the point. So, mainstream media, the New York Times even presented an article about the issue. Studies begin to untangle obesity's role in COVID-19. That was from Wu 2020. Personal accounts and references to research studies shows the morbidity and mortality of COVID-19 and obesity. Intervention and education. This is where Jamie and I come in, and all of my colleagues all around the world who practice Chinese medicine, and especially acupuncture in this regard. Acupuncture reduces BMI, body mass index. I was so happy to do this presentation. I was so happy to do this research. I was so happy to do this research because I experienced the improvement in my life from acupuncture and weight loss. And I have patients who've left testimonials that they've lost 40 or so pounds. And they worked with me. They worked with me for months, or maybe even a couple of years. But to actually see that Yao and Jay Yao and other researchers in 2019 had published this, that the overall efficacy of acupuncture relative control treatment was evident from a significant difference in the reduction of BMI. Basically, they found that acupuncture is effective for reducing body mass index. So there you go. I saw that it actually does that, and it reduces waist circumference. The study's been done. I'm sure there are other studies as well. I'm using this one particular, published in 2019. I wanted to make sure that the research that we found was obviously these, credible government websites, and also that this is going on right now. So more than likely, these things were published in 2020 or in the last 5 years. Acupuncture reduces waist circumference. The overall efficacy of acupuncture relative to control treatment was evidenced from the significant difference in the reduction of waist circumference. So that you have acupuncture and people who didn't get acupuncture, and they found that their waist circumference decreased. So woohoo, that's awesome. Intervention and weight loss in regards to Qigong and weight loss. So those of you who know, I do teach Qigong once or twice a month. I'm not a Qigong master, but I have so many patients that need Qigong. And I took some notes in 2 other presentations, and someone actually did a presentation regarding Qigong and its ability to allow people to be more agile, prevent injuries, and increase bone mineral density. Oh, I was so happy to hear that. So I wrote it down. Qigong increases bone mineral density. There's so much research on Qigong. Why do I teach Qigong? It is because it provides so many health benefits. And I've already done some Qigong videos. I just did one yesterday for Wednesday. This Wednesday, the Wednesday before Thanksgiving, 9 a.m., we'll be at the beach, far apart. You'll be out getting vitamin D. You'll be exercising. You'll be increasing lung capacity. You'll be strengthening the health of your kidneys. When you're overweight, you're putting weight on your kidneys. You're putting extra pressure on your adrenals. That's not good. You can keep taking all the medications you want, all the herbs, and all the acupuncture supplements. But until you exercise, and something that I'm very passionate about is that I treat my workouts like I treat my job. So that's important to understand. I average about 106 patients a week as of October, but it's been going on like this for a while. I'm 21 years in practice. I've been in practice for a very long time. And it wasn't like that. The first 7 years of my practice, I didn't see maybe like 1 to 30 patients a week if I was lucky. It took me a long time to learn how to grow a practice. I have no business experience, no marketing experience. I had to learn everything from the, hard knocks. But one thing that I've stayed consistent with when I started losing weight was how important health is. In 99, I was already licensed acupuncturist. I could not swallow my saliva due to really poor tonsillitis. A really intense tonsillitis. You don't realize how much you swallow your saliva. And there were health issues. There were issues like, I wasn't really seeing a doctor, and I took care of it too late. So ever since that experience, being bedridden for a month, not being able to walk my puppy, and every time I walked my dog, Kato at the time, I had a huge setback. And that really taught me a lesson that if I'm going to be a healer and help people, I better know how to take care of myself. So I've been on this ongoing mission since 1999 to let people know that your health is your responsibility. And if this presentation kind of scares you a little bit to making some permanent changes, be gentle with yourself. Supposedly it takes about 32 straight days to create a new neural pathway, which means it takes at least a month to create a new habit. You want to do something simple over and over and over, and we're going to discuss that. But hey, when I offer Qigong to my patients, it's $10 to my patients who are members. And if you're not a member, it's $30. I used to refer people to this master named Carl, and I referred to him. And he's been teaching Qigong since the 70s, I believe, 1970s. And people weren't, especially these are people who are trying to get pregnant and have different health issues, and people weren't doing it. It's pretty much given to you. You need to want to walk. You need to want to do Qigong. The more you say, I don't have time, or I'm doing this, or I'm doing that, you know what? Treat your exercise like a job. And if you're preparing to conceive, and I'm keep pushing the Qigong, it's for a reason. I'm just going to give a quick synopsis, and you can watch the video itself. If you're 35 and over, you should be doing Qigong, not just to try to get pregnant, but for a million other things. But here it says a Qigong intervention was associated with improvements in weight, waist circumference, leg strength, and insulin resistance. Oh my gosh, that's so powerful. By Liu, Miller, Burton, Chang, and Brown, 2011. That was 9 years ago. I'm going to repeat that because it's so powerful. The Qigong intervention was associated with improvements in weight, waist circumference, leg strength, and insulin resistance. So if you have any autoimmune issue, if you want to get pregnant, hey, in my practice, kids are free. Your family members who are 17 and younger, they are free. You, if you're an Elements in Harmony member, it's $10. I teach once or twice a month. $30 if you're not a member. It only costs $25 for an annual membership. You can do Qigong online for free. There's so many YouTube videos. You don't have to leave your house. You can follow the stay-at-home orders and just do it. But let me tell you, when you're on the beach, I put my feet in the water. When you're doing it in nature, and there's this point, bubbling water point, kidney 1 on the bottom of your feet, when you're connecting and grounding with the planet, there is a video on YouTube called The Science of Grounding. It's so powerful, and every one of my students really enjoy and benefit doing Qigong. We can be 10, 20 feet apart. Wear your mask. Do what you need to do to feel safe. But when you're in the beach in front of the ocean and no one's around you, and you're doing this beautiful Qigong, or if you're trained in Tai Chi, anyone who's trained in Tai Chi and Qigong, you know what I'm talking about. When you're doing it at the park, it's so different. If you are in the habit of hiking, you know just a few Qigong moves, just doing some Qigong moves. It's so powerful. I was listening to chapter 2 of The Power of Positive Thinking by the Reverend Dr. Norman Vincent Peale this morning. And this is a very, very powerful book. If you are not into reading, listen at least on Audible to chapter 2. I strongly recommend that you have the book and listen to it on Audible. Chapter 2 talks about how God has a rhythm. Now, if you have an issue with God, just use the universe or Mother Nature. But I thought it was so perfect because to me, all three are the same. So God's movement is perfect and it's very deliberate. If you go out to Mother Nature, you just go outside and you see like doesn't seem like anything's going on, but so much is going on. Wu Wei, do without doing. The grass is growing, but it takes time. Your effort to lose weight, and I speak this from the heart, because I know the struggle of losing weight, but you just do it every day. Just do it every day. When I was in college, I was heavy, and I was embarrassed. I was not the pretty girl, and it was a trying time for me. This was 91 to 94. And I had a dream. I attended the University of San Francisco. And I had a dream that I had long hair. And I was in the church that I grew up in St. Rita's in San Diego. Because I remembered the mirror. And I remembered that I was slim. And I remember feeling that it was real, that I wasn't fat. And I didn't like waking up because that wasn't my life. And it was a glimpse. It was a glimpse to my future, but when you're heavy, carrying extra weight, 5 extra sizes, especially when you're a teenage girl, it doesn't feel good. So it wasn't until I started studying Chinese medicine when I was 20, and that's when my life changed. And I did a weight loss video, so I'm not going to talk about that. But I do want to share that I understand that losing weight is hard. I'm 46, I'll be 47 next month. And I've been doing good, doing jiu-jitsu, doing Muay Thai. I got a full schedule. I got 3 kids. You know, I understand that life gets in the way. So I actually signed on to a product, and it's helped me lose circumference, waist circumference. So I'm not going to talk about that, but if you're interested, let me know. But my point is, I know that when you're in the process of losing weight, it's like watching grass grow. It takes forever. And it's like one day, then the next day, then the next day. And you just want to see results. You just want to lose 10 pounds in a month. And that's not how it goes. I remember when I was like between a 0 to a size 2. Post-college, I felt so proud of myself. And right now I'm wearing some pants that I haven't fit in a long time. So I'm really happy with my results with my workouts and also with the product that I'm taking. And I don't take just anything. You know, I got certain supplements and health herbs. As an herbalist, I'm really particular with what I take. And I don't take the same things every day. But this product has been extremely helping me. But I remember when I was 43 and I found out I was pregnant, and it was a surprise. My husband and I didn't think we were going to get pregnant again. We weren't planning. And we're very happy that we did, because we have a baby boy. And if it was going to be a baby girl, that would have been awesome too. But definitely a baby boy, because his name was going to end with him. And he was raised with all women, 2 older sisters and a niece. And his mom is really a strong figure in the family. So it's just been him and his dad. So when I found out I was pregnant at 43 years old, I remember thinking, oh, I gotta do this all over again. So yeah, I understand. So you see, so please do ask to watch my Qigong video. I am going to teach Qigong, and we are going to be very far apart, and everyone is welcome to wear their mask. I am going to be in the water, in nature, and I'm going to do Qigong. I don't do Qigong to lose weight, but now that I know that Qigong has research, proven benefits of decreasing waist circumference, weight, legs, improving leg strength, and insulin resistance, you bet I'm going to be continuing to push the Qigong. Tai Chi and weight loss. Participants in 2 intervention groups also had significantly greater decreases in waist circumference and FBG, fasting blood glucose, than those in the control group. So acupuncture group and control group, people who did Tai Chi, significantly greater decreases in waist circumference and fasting blood glucose. I've been trained in Yang style Tai Chi, as most Chinese medical students. I'm currently not studying Tai Chi, but for many, many years I practiced my Tai Chi. I've forgotten my forms, but I'm sure I can pull it up on YouTube. It's a beautiful art. It is a martial art. Tai Chi is a martial art. And for those of you who don't know what Qigong is, I'll give you the actual definition. I loosely define Qigong as cultivating your internal energy. So let's find the actual definition of Qigong. So your Qi is, definition, a Chinese system of physical exercises and breathing control related to Tai Chi. That's not really the answer that I wanted to get, but basically you're cultivating your breath. You're cultivating your internal Qi. So I just want to give you the data. And we can discuss that at another time. Herbs and weight loss. Oh, let me see. Now we're going to talk about herbs and weight loss. Most of these studies showed anti-obesity effects, such as decreasing body weight in humans or body weight gain in animals with or without changes in fat. So I'll repeat that. So most of the studies regarding herbs showed anti-obesity effects, such as decreasing body weight in humans with or without changes in fat. So that's very promising. So one thing that I shared about the weight and I do have some notes on the acupuncture. I'm going to go back a little bit. Research has found that acupuncture has shown an overall efficacy in significantly reducing BMI. Since BMI increases a risk factor for an obese person, then acupuncture can be a valid and dependable solution in helping a person decrease BMI. Of course, depending on frequency of treatments, overall length of therapy with the practitioner, and lifestyle changes. Evidence has also shown that acupuncture reduces waist circumference compared to the control group, just like BMI. Acupuncture shows significant difference. That's the key word, significant difference. This evidence provides acupuncture as a promising solution to reducing waist circumference if patients are consistent with their acupuncture visits and follows the practitioner's guidelines. So I say this over and over in quite a few of my videos. I have an accountability video. I've done it 5 times. If you go under once a week, expect nothing. If you go once a week, I expect 30 to 70% improvement. This is for a variety of things, not necessarily for weight loss. Let's say for pain, I expect 30 to 70% improvement within 5 to 15 treatments. If you're going 2 or more times a week, let's say I'm talking about neck pain, I want to see 30 to 80% improvement within 2 to 6 weeks. So weight loss is completely different. Something that I like people to know is the beginning phase in my practice of easy cases is those first 10 treatments. The beginning phase for chronic issues is those first 20 treatments. So one thing that I share about weight loss and acupuncture is it took me from 1994 to 1996 to lose 48 pounds. That story is never going to change. It's always going to be that data. And the same thing in 2004 when I gave birth to my first, 2010 when I gave birth to my second, and 2017 when I gave birth to my third. So be gentle with yourself and be consistent. You saw me get a little emotional in regards to weight, and I think that's very important for me to share because it's easy, right? It's easy for people to say, just lose weight, just lose weight. Well, you get a little resentful when people are, slim and sexy and they're wearing like a size 2 to a size 6, and what do you know? You've never dealt with weight issues. You've never dealt with eating addictions. But when I tell people that, yeah, I have, and I healed from an eating addiction, binge eating uncontrollably, chocolate cravings, sweet cravings, salty cravings, thinking about your next meal, not being able to stop, just going for seconds and thirds, I understand. I don't have those health issues anymore, but it took time. Who I am now at 46 is not the same person as I was when I was 20. So sometimes, Andrew, my husband, will say, when people say they're stronger now than they were younger. I remember Terry Crews, the comedian, the actor. I love him, and he does intermittent fasting, and he's obviously in great shape, and I think he's over 50. I believe he's over 50. I don't know how old he is, but he talks about, he's stronger now than he was when he was 20s. And sometimes my husband will argue about that. But I'm like, I really believe that I'm much healthier now than when I was 20. So acupuncture has a tremendous thing to do with that. In regards to herbs, this is a great opportunity for us practitioners to share with our patients that a beautiful aspect in Chinese medicine is that patients are typically prescribed not just tailor-made acupuncture treatments, but also herbal medicine prescriptions considered for each individual. That means every acupuncture treatment for every individual is different for that. It's individualized. Herbal medicine is also individualized, especially if you're going to an herbalist who concocts their own formulas. We do not have a one-size-fits-all type of medicine. Evidence shows that herbal medicine decreases body weight in humans with or without changes in body fat. So if you give me the presentation before ours today was in regards to anxiety. If you give me 50 people suffering from anxiety, and keep in mind, if I'm seeing over 100 patients a week, you bet at least 30+% of them are coming in for some level of anger, anxiety, stress, or anger, depression. And how does that affect us physiologically? The body follows the mind follows the spirit. How we are emotionally, our mindset is going to impact our daily activities. If a person is depressed and they don't want to leave the house and they're feeling unmotivated, I had a gentleman like that this week. You know, the desire to work out just isn't there. And what do men need to do? If you listen to Dr. John Gray, he's going to say at least 3 to 4 times a week, at least 45 minutes a day. Men, 45 minutes each time, need to get a good sweaty workout because that increases your testosterone. If I'm correct, Dr. John Gray, he's written over 30 books. He's most known for Men Are From Mars, Women Are From Venus. But one of my favorite books is Venus on Fire, Mars on Ice. He really, really talks about that the average 40-year-old man now has a testosterone level of a 70-year-old man 30 years ago. You can check that out for yourself to make sure that that statement is correct. But that's why your physician, your primary care provider, is constantly checking, is usually checking men's testosterone levels. In our medicine, we are talking about your Jing Qi in Chinese medicine. That's why I'm such a big advocate for Qigong, because it's easy to do for the lay person. There are very, very advanced forms of Qigong. And like I said earlier, I'm not a Qigong master, but this is something that you can access every day to strengthen your battery, which I did talk about in my video yesterday, in my most recent Qigong video. You want to strengthen your kidneys. How often do you hear that on a daily basis? I'm going to strengthen my kidneys. I used to live in San Francisco, and I'm sure this is like this in many Asian countries. But go to San Francisco and Golden Gate Park and some other places, they're doing Tai Chi. I used to teach Qigong in my earlier years. I started practice in 99. And when I was a student, you know, just as a student, I knew enough Qigong to teach lay people on the bay in San Diego. And I remember one time this guy was riding his bike and he was honking his, you know, his little bell on his bike, and he was like, woohoo! I mean, it's just, there's so many things to help us feel better. You have to access it. You have to want to do it. And herbal medicine's relatively cheap, and there are usually no side effects. I am a big proponent of not just going to the store and buying all kinds of supplements, but getting professional advice from an herbalist, from someone who's licensed to practice Chinese medicine or Western herbal medicine. So please consider that. Don't just, well, this is good for this, and this is good for this, and this is good for this. I've had some patients come in with 30 plus supplements that they're taking every day, and that's, in my opinion, not healthy. In my opinion. I had a chiropractor who came in with serious liver issues, and she was pregnant, and she came in with 2 Nordstrom bags, you know, like the regular, like shoe size bags of medications, 2 medications, 1 herbal supplement from her midwife, and a ton of supplements that I think her naturopath, and I have tremendous respect for naturopaths. And she's like, my doctors and my midwife are very concerned about my liver. I looked at all the herbs and I was like, did anyone talk to you about all these supplements? Do you know what it's, she's a doctor, she's a chiropractor. And this is her first child, and you know, she just was, she was second guessing herself. She was just following the advice of a professional. In my opinion, 30 supplements is a lot, especially for a pregnant woman. So I don't want to go into that. Well, she improved. I did acupuncture. I didn't touch her medication because legally I'm not supposed to. I said, I want you to talk to your naturopath doctor in regards to all these supplements. Cut down to 25% of all these 30. So maybe 3 to 5, if anything. If not, keep it down or rotate. I can't remember exactly what I said. This was at least, I don't know, I want to say 2011, 9 years ago. And sure enough, she started getting acupuncture, started improving. She started cutting down the supplements to more specific ones that she needed. She's kept with the one her midwife stayed on, recommended, and the 2 medications from the doctors, because legally and ethically I'm not going to say anything about that. But I want her to have a hard talk with her naturopath about having to be put on all those natural supplements for a pregnant woman who is dealing with liver issues. You don't want to put that kind of pressure on your liver, especially when you're pregnant. So always get someone's second advice, third advice, fourth advice. Fourth advice. I always tell my patients, I'm sharing with you my opinion. Get other doctors' opinions also. So she got better and she gave birth to a healthy baby. So we talked about, so I told you about the herbs. Now, Jamie's presentation, we went back and forth. Part of her presentation was talking about exercise and weight loss. She did a great job talking about the Nordic walking. It's a sport or activity that involves walking across country with the aid of long poles resembling ski poles, or just walking. After 6 months, both NW, Nordic walking, and W group, walking, decreased significantly BMI by 6 and 4% respectively. So those that did the Nordic walking reduced 6% body mass index, and those that did the walking group 6 months also decreased in body mass index. Their waist circumference, WC, the waist circumference went down 8% if they did the Nordic walking and 4% if they did the walking respectively. So Nordic walking like you're, using ski poles, and walking, 6%, 4% decrease in body mass index respectively, and waist circumference 8% and 4% respectively. So obviously it was more with Nordic walking because you're involving your arms, involving your back. You're just not moving your legs. So Jamie talked about meditation and weight loss. Results suggest that mindfulness meditation effectively decreases binge eating and emotional eating in populations engaging in this behavior. So what are we talking about? Binge eating, emotional eating. And I shared with you earlier about my experiences in a very emotional manner. I didn't expect to do that. I apologize. But I hope that my emotions triggered something in some of you to understand that, hey, it's not just some woman who looks like she's an average weight telling me stop being fat, because I've been there. I've been heavier. And this particular topic, meditation and weight loss, is extremely important to me because I also just chose for my 10-page narrative review on mindfulness meditation and a calmer society. I'll do another presentation on that. Hopefully I did the paper correctly. I've never written a narrative review, and I'm really proud of it. But someone asked, I shared this on my research forum with my own students, this presentation with Jamie's name, but because I'm actually really, really proud of this presentation. But a medical doctor in my forum, she asked me if I can share my narrative review. And I said, I will share it after I grade it, but I'm going to share a video of what I've shared. It's a limited, there are 11 studies that I analyzed, and in regards to mindfulness, meditation, and feeling calm, and exploring how that can create a less violent, a calmer globe. In all of those 11 studies, and more of the studies that I didn't put into the paper, because you think 10 pages is a lot, but it's really not a lot because you got to go into detail with those relative studies. Every one of those studies, meditation, hands down, mindfulness meditation, and other forms of meditation, had an improvement in the majority of those who practice. So when you read something like this, when you hear results suggest that mindfulness meditation effectively decreases binge eating and emotional eating in populations engaging in this behavior. This was published 2014 by Caterman, Kleinman, Hood, Knackers, and Corsica. You know what? I'd have to say, I mentioned that I had an eating disorder. From my experience, this is true, and I'm so grateful that there is data on it. And the fact that I did this, my 10-page narrative review, which all of them were government published data, research. You can find them online. I really enjoyed seeing that. So then you can say, hey, when you meditate, it's been proven over and over and over in a variety of methods, research methods, how it impacts a person's psychological state. So the next thing that we talked about was Jamie presented meditation and eating behaviors. Diet, this is from Ferraris and fellow researchers in 2018, so 2 years ago. Diet supplementation with symbiotics prepared using selected strains such as Lactobacillus gasseri strains showed to exert weight reduction and anti-inflammatory activity in large independent studies. So let's break down just that statement in just that sentence. There were large studies and certain supplements, and they included Lactobacillus gasseri strains showed to exert weight reduction and decreased inflammatory activity. Their administration, together with galactomannan and or inulin fibers, may increase weight management effects due to synergistic effects. So they work together. So the certain strains like the Lactobacillus gasseri strains and also fiber, it may increase weight management when they work together on short chain fatty acid production and microbiota reconfiguration. So the health of your digestion, having good bowel movements, being able to digest your food well. From a different study, 2016, this was published by Stefanska, Wendelowitz, Konarzuska, and Ostrowska. An average reduction in the women's body weight was 4.1 kilograms, give or take 3.1 kilograms. The percentage content of the fatty tissue was reduced by 2.5 kilograms, give or take 1.1%. On average, after modification of the nutrition, a statistically significant decrease in the frequency of wheat bread, cream, fat pork, and eggs. So they found that when people reduced wheat bread, cream, fat pork, and eggs, that women's body weight decreased, and especially in regards to their fatty tissue. It seems that the dietary procedure, which is aimed at obtaining the most advantageous effects of the reduction in the body mass of obese patients suffering from depression, should be based not only on proper selection of food products and reduction in the energy value of the diet, but it should also take into account actions aimed at introducing permanent lifestyle changes, including increased motivations of the patients to undertake physical activity. So you can't just change your diet, is what they're saying. You have to, as quoted, increase motivation of the patients to undertake physical activities. So I know this is I want to be very thorough. I'm presenting this with a lot more details, but I think this is extremely important. You don't want to just lose weight, right? It's nice to lose weight. Everyone has, January 1st, I was telling my 16-year-old Angelin, January 1st to January, 5, all these people are going to join the gym. New Year's resolutions, I think, typically goes away in 21 days. So 2.5, 3 weeks, if I'm correct. Because there's this motivation. Why are you, and I asked her, we just had this conversation about a week ago. I said, why do people wait till the first of the year? If it matters to you, you do it now. Because I have a very do it now attitude. If it matters to you, do it now. If it matters to you, go to Muay Thai now. If it matters to you, ride your bike now. If it matters to you, go walk at the beach now. Do it now. Don't wait till the first of the year. That's why when people ask me, what's your New Year's resolution? I'm like, I do my resolutions every day. Because I used to have resolutions, and I was one of those people where 2.5, 3 weeks, if it matters to you, you do it now. You don't wait till some arbitrary day. Because there's a new, every religion, almost every religion has a new year. So, just as we honor globally January 1st as the new year, it can be a new year today. Make your resolution today and stick with it. I know it's hard, but if you want it, I'm going to tell you what I tell my students in the business acumen. If you want it, you will make it happen. If it matters, you will do it. All right, so we talked about diet, and then I presented our expected results. The purpose of this presentation is to show the risk factors related to obesity and COVID-19. So I like things in threes. Acupuncture 1, 2, 3, business acumen 1, 2, 3. I like things in three. Keep it simple. Lose weight, become healthier, reduce any severe illnesses related to COVID-19. So the number one purpose has to be making sure patients lose weight. I implore you guys to lose weight. I am still working on losing weight. I'm in a good weight level, but I do love to eat. But I love to exercise too. So one of my colleagues asked me, Anna, how do you tell your patients to eat? And that's a long discussion, but it was on text and we're international. I just said, 90-10, 90% eat really healthy, and 10% of the time eat whatever the heck you want. And I think, I ever since I implemented that into my life, I found losing weight to be a lot easier. You got to be gentle with yourself. Ask my students, whether my students want to see 5 patients a week, 30 patients a week, 80 patients a week, or over 100 patients a week. They can trust me on my advice because it's going to happen, because I'm going to teach them what I do and it's going to happen. So I share with you my story about losing weight because I can tell you if I've done this. If you know me, I love systems. A system is a repeatable process that's going to give you the desired results most of the time. And if you just stick with the system, more than likely the results that you're going to get is going to be similar to everyone else who's following that same system. That's why I have a very specific system in regards to my fertility. I have a very specific system in regards to weight loss. I have a very specific system in raising my kids. I have a very specific system in, my own way of educating myself. I only take 1 class a semester. Being in my doctorate, I can only take 1 class a semester. There's a system for everything. My kids play violin. I play violin. There's a system. There's a reason why you do scales. You want to follow a system because you're going to get predictable results. If you do the Qigong, you will get healthier. If you do Tai Chi, you will get healthier. You do acupuncture, you will get healthier. You're talking to an acupuncturist. What do you think I would be saying if I were a chiropractor or whatever other type of healthcare practitioner? You want to follow something that's going to, the more avenues you can have to creating a smaller waist size and lower body mass index, the more you can target that goal, and you will hit that goal. Better eating patterns, better exercise habits, maybe waking up a little earlier, getting plenty of sleep, not eating late, watching your alcohol consumption, just to name a few. So we want to make sure that patients know that your weight matters. Evidence shows that the risk factors increase in having challenges of survival if they are infected by COVID-19. Remember what we discussed earlier. The higher your weight level, the more weight you're carrying, your chances of being infected with COVID-19 are stronger. We expect with our education and intervention to help people get to healthier weight levels. They will become less susceptible to being infected And their chances of survival and full recovery are greater if they are healthier weight. Losing weight naturally yields a person to a healthier life. Oh, my best guy friend, his niece died on the table. I think it was in Mexico where she was doing the liposuction, I believe. I'm not saying to not go to Mexico and get your, I know a lot of people do that. They go to Brazil, they go to Mexico, they go to any other country to get really sexy, really, really sexy. Take the fat out. And then there's the old-fashioned way, which is diet and exercise. And I know it's hard. No one said it's easy, but if it matters to you, you will do it. Part of our education would be to really emphasize living a healthier lifestyle. Most people on the planet have a basic survival instinct. Jamie and I theorize that if we can effectively educate the average person that being smaller in waist size and having a lower BMI, that their ability to not just live more healthily, but actually prevents being infected and prevents being hospitalized, then perhaps more people will be motivated enough to make permanent changes in their lifestyles. As shared in this presentation, the more weight a person carries, the higher the severe illnesses are linked to COVID-19. Thus, our third main goal is to help people have less chances of having any other severe illnesses related to obesity and COVID-19. That concludes the presentation, and I just want to share some accolades. I'll keep it brief. I want to let my husband know that you've been a tremendous impact on my life, and you've been with me. We've been together since 2001, and we decided to get married in 2002. We had our first child in 2004. But we knew each other for 11 years as acquaintances. We were not friends. We were acquaintances for 11 years. But we just knew in 2001 that we wanted to spend the rest of our lives together. And hopefully we're still on that trajectory. I have a lot of patients here who have spouses who don't appreciate them or respect them or give them the space they need in order to become the better people they want to be. So I want to appreciate you for that. And I want to share with my kids that, it's hard. I'm not home a lot. And the last few weeks, I've really inundated myself with writing my narrative review. I want my future mothers to know that I've done those 13, I think it's 13 fertility videos for a reason. And there was a lot of sacrifice in order to achieve those babies. You're seeing me now with a lot of patience, but you didn't see me when I had no patience. That's when I started having babies. I wanted to make money so badly, but that was God's way of saying, have your babies now. I'm getting emotional about this because I have a lot of patients wanting to be mommies. You're seeing me at a place where many of you want to be. You want to be mommies. Make the sacrifices. And I didn't sign into my doctorate until I was, this year, 46. And they didn't have the doctorate program when I was in school. In 1998 was when I graduated with my master's in Chinese medicine. And when they started having it, I owed a lot of money for my school loans. And I started having kids in 2004. And it just wasn't the right time to get my doctorate and start raising kids at the same time. It just wasn't time. And that's one thing that I understand. I don't know if it's because I'm near the ox. I'm very deliberate. I can be very slow and deliberate. And there's something very powerful in that. Mother Nature is very slow and deliberate. And like what I said when I was listening to Dr. Norman Vincent Peale, the Reverend Dr. Norman Vincent Peale, that he said, Mother Nature, God, moves very slow and deliberate. There's power in that. And so we like a 3-year difference between pregnancy, delivery to conception. And I did that. I did that. They're 6 years apart and 7 years apart. I want my kids to know that I really appreciate you for allowing me to study away from home. so often. I worked on my narrative review for the last few weeks, maybe at least a month or so. There were 4 main assignments for this class, public health and preventive medicine. Each class, this is especially for my kids to understand, but especially my 16-year-old, my junior, Angelin, I presented, um, for my first assignment, I turned it in, I think, a week and a half to 2 weeks early. The second one, I definitely turned that in maybe a week early. The third one, which was my presentation today, it was submitted last week, but I had that done 99% by October 31. It wasn't due until last week, November 15. And then the paper that was due today, I finished that completely 2 days ago, but I took weeks and weeks on it. It's okay to be slow and deliberate. And when I was in college, I won an award for most likely to be busy, and it wasn't a good award. That was in my dorm. They said, when we see you, you're just constantly busy, but I was busy doing the wrong things. So I just want my kids to know I really appreciate you guys for, I'm in a position in life where I have a chef. She comes every other week or so, and I pay the same amount as if I were cooking. And I haven't been in the position to cook while being a student and seeing over 100 patients a week and being a mom. Something's got to give. So for my fertility patients, know that the money can come later. Your career can come later. I had to give up martial arts for 8 years. That's hard. I had to give up something that I love for 8 years. And I didn't sign into jiu-jitsu till I was 38. It's hard. It's hard to make these changes in your lives when we want something so badly. And I wouldn't have it any other way in order to achieve that picture. 3 babies. And I want my students to know, with the business acumen of successful acupuncturists, the website successfulacupuncturist.com, I want my students to know that, I got emotional in this video, and part of it also is the presentation prior to this was about mental health, and I know some people who've committed suicide, so it really has made an impact on me when I was making this presentation. This is, I think, a very poignant topic for all of us on the planet to understand the severity of this disease and of this virus, and that we have in many ways to honor Mother Nature, to run her course for whatever reason. It's just my opinion that I think she does this every century. There was the Spanish flu, which wasn't from Spain, as my understanding is. Who knows? I wasn't around then, but maybe she does this pandemic from the beginning of time for whatever reasons, and we are currently living it. And if in our profession, I'm speaking specifically to my colleagues right now, in our profession, if we can have a positive impact and a very meaningful impact on our patients, to help our patients know that we care. Sharing my weight loss journey with my patients over the years has made an influence on them, motivated them to try. I didn't start wearing jeans until I was 40 years old, so almost 7 years ago. I just didn't feel comfortable in them. I know some people don't believe me when I say that, but yeah, I never really had jeans because I didn't feel slim. Even when I had lost all that weight, just buying jeans was, impacted me psychologically. But finally, I started wearing jeans and I felt good in them. So for my patients who want to lose weight, and it's hard, just one thing at a time, slowly but surely, one thing at a time. Be gentle with yourself, but do something positive every day for that goal. And we'll talk about that privately. But to my students, I just want to let you know, I appreciate you for encouraging me. Many of you inspire me. Many of you are already doctors of acupuncture and Chinese medicine, doctors of oriental medicine, OMDs, and medical doctors, chiropractors, doctor of pharmacy, naturopaths. I want all of you to know that you inspire me, And I hope that this presentation today has been of tremendous value to you. And again, to this very soon to be Dr. Jamie Kimball, congratulations to you and the rest of the 2020 graduating class from Pacific College of Health and Sciences. Have a great, great day.